So we're here with Dr. Gerald Simons from Southampton Stony Brook Tick-Borne Disease Resource Center. And we have some questions to ask you. We're hoping you can help us out and our public.
Sure.
Yeah. One of the things that is going on right now is everybody's out pumpkin picking and they're out for the fall, and they sometimes hiking and sometimes camping tend to think that tick season is over. But we know better than that it's really never over, and that the nests are really something to watch out for right now. And where would people find tick nests? And where should you steer clear of? Where should you really check yourself after? And what can you do?
Right. So basically, ticks are a year-round problem, right? So it's not even like in the winter, you can still see ticks unless it's freezing weather. So we know that the black-legged tick or the deer tick, that adult female with that orangey back, tends to have its babies in the spring. Like St. Patrick's Day to Tax Day, we look for those larval and nymphal ticks. And now in the fall, we're in peak Lone Star tick season. So we see a lot of those little baby Lone Stars, and those are the ones that can carry alpha-gal, Ehrlichia, and Rocky Mounted Spotted Fever. And you're right, we tend to see a lot of Lone Star tick nesting areas, typically on the borders of forest and woods and the corners of yards, even in beach dunes. And it's not uncommon for someone going to look at the fall leaves as they're hiking around the Adirondack Trail or anywhere on Long Island. They step on a nest. They might have 40, 50, 60, even more than 100 little nymphal or even larval Lone Star tick bites on them.
I am one of those people that it happened to. Yeah, it's
right.
Awful. So itchy. The itchiest.
So people that are taking notes, you want to write down baby deer ticks in the spring, baby Lone Star ticks in the fall. So
a lot of people can call those chiggers out here. And they're actually been trying to explain to people that there are no chiggers on Long Island, that they're not the same as those bugs that burrow into your skin. They're actually larval or nymphal ticks that are biting you and creating a reaction.
Right. And one of the things we know is, at least in Suffolk County on Long Island, working with Dr. Scott Campbell, who's the tick specialist for the Department of Health, Suffolk County, they've been studying this for almost a decade. And we know that there are definitely no chiggers on Long Island, that they're definitely those larval or nymphal Lone Stars. So maybe in the mid part of the country, we might see chiggers, or even down south, but northeast, especially on Long Island area, we're not seeing chiggers. We're seeing those little baby Lone Stars.
Right. And what should you do if, like, you find yourself, now, okay, this isn't chiggers because of where I live, and this is definitely nymph ticks or baby Lone Star ticks biting me? What should you do? How do you get them off, first of all?
I mean, I like people to have like a very basic lint roller, and you run the lint roller over your clothing and even on your skin, and that'll pick up a lot of these little baby ticks that aren't completely embedded or engorged. And it'll also get any of the loose ones that are off of you. And usually a really fine pinpoint size tweezers can be used to remove the smaller ones. And everybody you talk to has a different remedy for what to do about baby Lone Stars, or what some people are still calling chiggers. Some people put clear nail polish on it to stop the itch. I like using old-fashioned Lugel's iodine, which you can get at a lot of mom and pop pharmacies. Yeah. Iodine is what we scrub the skin with before surgery. So it kills a lot of infection on the skin. It gets rid of itch. It kind of helps to prevent some of that itchy allergic reaction. And even though I haven't scientifically proven it, in like a double-blind placebo-controlled study. I know I've told patients that if you get a Lone Star tick bite, avoid any of the alpha gal triggering foods like meat for about a month, and maybe that'll help to prevent that alpha gal sugar molecule from, activating in those patients. And unofficially, people that have
Right.
gotten these
Yeah.
Lone Star bites that have avoided the triggering food, I'm seeing less and less alpha gal from these patients.
Yeah, I tell people that all the time, as per you.
Perfect.
Yeah.
Fantastic.
Yeah.
Mhm.
You know me, it's all about us. It's all about education.
Exactly.
I want everybody to know
Yeah.
what is out there and not to be afraid, but to know what to do when you're in these situations.
Right.
So they should also then strip their clothes, throw that in a hot dryer, correct?
Right. Yep. As soon as you get home, you want to put all those clothes in the dryer because the heat will kill the ticks. Of course, if you try to wash them, ticks love moisture. And, the last few weeks, at least in the Northeast, I think has been a little more moist. So the higher humidity and moisture is only conductive for, more ticks growing. So yeah, you definitely want to strip down and you want to get your clothes in the dryer. I have these signs hanging up all over, wear repellent, check for
Yes.
ticks every day, shower soon after being outdoors, and let us know if you get a fever or a rash, right?
Yeah.
I
So,
need to my car.
Yeah.
Can
I'll
I
get
have
you a few. Exactly.
send me
Yeah.
a bunch of them? I'll paste them all over my car.
It's just good information because if you do those things, you can be out indoor. Sorry, excuse me. You can enjoy the outdoors here safely if you do those things. Check yourself, wear the repellent. This is what you do if you get a rash. Do this. I mean, if you have a game plan, there's a little bit less fear in it. I feel, for myself at least.
Right. Yeah. And Jen, definitely using, preventive, like the Three Moms Organic preventive in 2 layers on your skin and on your clothing, right? So you've got 2 layers. You're wearing the light colored clothes, you're stuffing everything into your pot, and you're stuffing your pants into your socks.
Right.
You're checking yourself regularly.
Permethrin on your shoes. That's huge.
Yeah.
That's the
I'm
first
a permethrin fan, and I've even told some of my landscapers and people that are going into an endemic area, I'm like, if you have to use a little bit of permethrin on your clothing, it's better to get that on your clothing and less of a chance of getting a tick on you.
And you could use the natural repellent on your skin and use that other stuff for your clothing and your shoes.
Right.
The skin.
Mhm.
Great too.
And permethrin, the only problem with that is you have to spray it and then let it dry. You can't just take a can of permethrin out with you and go, oh, I'm going to spray it on me now, because that's dangerous for you. So you have to be prepared. And that's what we're talking about. Be prepared.
I do that with the kids' sneakers. I put them out on the front deck and I spray them, let it dry overnight. And then I kind of think that they're good for 2 weeks. Is that a basic timeline?
Even some studies show it's good for a month.
Okay.
And what I tell a lot of people do is you have like an outdoor pair of jeans that you treat regularly with permethrin, and it'll even survive a few washings in the dryer. So,
interesting. Okay. That's all good stuff for sure.
So thanks for all that. We're going to jump to mental health and Lyme disease, right? I'm not aware. Are there other tick-borne diseases that can cause that mental health?
Huge. I think the big one is Bartonella, right?
Okay.
Now, most of us know Bartonella as being like cat scratch fever. You get scratched by a cat, and fleas and flea larvae can transmit that to a cat. But the same way that fleas can carry Bartonella to a cat, ticks can also carry Bartonella and give it to people.
From like rabbits to us? Or
well, rabbits actually carry a different germ, which is tularemia, right? That's a classic exam question everybody is always asked. Someone gets bitten by a rabbit, the answer is always tularemia. Someone gets scratched by a cat, we think of Bartonella. But ticks can carry Bartonella very similar to the way that fleas and larvae can carry that as well. So Bartonella can definitely cause panic, anxiety, phobias. Lyme disease typically can cause all different types of psychiatric symptoms, anxiety, depression.
Memory
Um,
loss.
and, yep, usually accompanied by like brain fog, almost like dementia type presentation. In fact, I think the two of you probably were up nights thinking about my Chris Christopherson story about how he had dementia, but it actually ended up being Lyme disease.
Yeah.
Yeah.
I was actually diagnosed. It was going around. I was the doctors were suggesting that I might have early Alzheimer's at the time. You know, when we were going through this, and when I was seeing one doctor after the other for whatever, like the headaches, and depending on what doctor I was seeing, but a doctor had started talking about possible early Alzheimer's because I forgot how to turn on the sink. I forgot how to tie my shoes. I forgot how to drive a car. And it wasn't consistent, but it was at times. And it was really, really scary when those things would happen. Not being like, I would be in the shower and I was like, I would get out of the shower and I was like, wait a second. I didn't wash my hair. I didn't condition my hair.
Just
like just complete, like lost pieces of time. And it was terrifying. It was terrifying to be a young mom. And well, I was never a young mom, but to be a mom and have young kids and, you know, to be going through this, it was absolutely terrifying. So go ahead.
Right. And we definitely know that there are so many strains. There are different types of Lyme disease. We talked about in our previous video, at least 4 well-established strains and up to 133 variations. And some of those Lyme strains may just affect the joints, like you get Lyme arthritis in the knee. Some of those strains may just affect neurocognitive. You may have headaches and mood change, and you could even have a combination where you have joint pain and headache as well. And like the classic story I see is like that 30-40-year-old hiker or outdoors person who all of a sudden develops depression, anxieties, or paranoia. Like they have a new onset, like psychiatric type of presentation. And I'm like, you're 40 years old with new onset depression or eating disorder or dementia symptoms. I'm like, usually these things are going to manifest a lot earlier than that.
Right.
In fact, one of the most fascinating stories way back in Salem, Massachusetts, where they actually found that many of the women accused of being witches, seeing hallucinations and screaming and cursing and talking in strange languages. As they look back at some of the literature, they found that these women accused of being witches also had like facial asymmetry. They had what were labeled as a witch's mark, which is a red circular lesion. And, they were acting crazy. And that was some of the 3 key points of how they would accuse you of being witches.
So
and of course, that was an endemic area of Lyme. They had Bell's palsy, they had EM rashes, and classic neuropsychiatric symptoms.
Wow.
And to think not just them, but anybody that is going through these issues and just thinking, oh my gosh, I'm going through depression, but not really able to pinpoint it. I think it's important for people to know, like, the symptoms. I mean, the symptoms go on and on and on, don't they?
They could be, it's like the new great imitator, which is why, especially in endemic areas, we encourage psychiatrists to maybe ask about tick exposure, ask about joint pain, ask about, other systemic types of symptoms that might relate, especially in those patients with neuropsychiatric disease that don't respond to a medication or don't respond to several different types of medications.
Right.
So there's been a new study out by Dr. Fallon, who's a psychiatrist out of Columbia. And he was talking that the more tick bites you have, the higher your likelihood of developing some sort of psychiatric illness. So whether it's just depression or depression, and I mean, it can build and build. So the more you have, the worse it could be later.
Or
correct?
Or the more untreated, right? If you
Yeah.
don't get the, like in your case,
Yes.
right?
Right. The old-fashioned name for that is what we call the loading theory. So you have one tick bite, and maybe that gets to your joints. A second tick bite then gets to your brain. A third tick bite gets to your cartilage, kind of on and on and on that way, and they kind of culminate over time. And especially with Lyme disease treatment, we talk about that famous structure called the blood-brain barrier. Not all medications will get through the blood-brain barrier. So you might be effectively treating muscles and joints, and then you're not necessarily getting to those deeper neurologic symptoms, which kind of explains what Dr. Fallon's talking about these multiple types of exposure that build over time.
Yeah. Like IV antibiotics was the only thing that really made me feel better but I was
Sick for 10 years.
Sick for 10 years and build up over time. Right. So
right. IV antibiotics are not nearly as common as they used to be, especially with improvement in oral medications and injectables. But definitely you'll still see that occasional person walking around town with an IV catheter in their arm that they have to flush and connect on a regular basis.
Like, oh my gosh, this is hardcore. What is going on with you?
Yeah.
She's like, oh, I'm sorry, I have to go and give. I'm like, wow. And it really opened up my eyes because I had no idea that all of those symptoms can be, correlate with Lyme.
Yeah.
Right. Mm-hmm.
I wound up seeing about close to 50 different specialists for different things that were going on with me.
Over 10
my
years.
Heart, over 10 years. My heart, my kidneys, my joints, my bladder, my brain, my hearing, my vision, all of those things. An ENT for my nose and throat. I also had alpha-gal somewhere in there. So
yeah. And look at her now.
This is what we always talk about, how one person it's neurologic, one person they have more sensory symptoms, other people have more bone and joint and cartilage type symptoms. So, and that also can mean that various different types of treatments are required. One person might take doxycycline and it works really well. Another person may take Claritin, according to Stanford University, and that works well for them. So it's very hard to cookie cut the exact same treatment for each person because there are so many variations and then so many overlapping versions of exactly what's going on.
And they need to find a doctor like you who is literate of, all of these things and keeps trying and listens to them.
Right. And I mean, you have to make sure you know what you're treating. I had one woman who was absolutely convinced she had Lyme disease. It was the cause of everything. And I was a bad person for not giving her doxycycline. And we found that she had thyroiditis and needed her thyroid treated. So, especially in the Lyme community, I'm always reminding people, you still have to check for everything else. You don't want to miss a cancer or an autoimmune disease. And, it's not always all just Lyme disease.
Right.
Right. Yeah.
And Lyme disease can set off some autoimmune diseases as well. Just like anything else, a bad strep infection can set off autoimmune diseases. But you can,
Right.
This was awesome. Is there anything else that you wanted to add? Any other things?
I mean, people, guess what? It's autumn. The leaves are changing. People are going to go outside. People want to start, looking at leaves changing. People are going to start raking their leaves. Leaf piles attract a lot of ticks because it kind of stores the heat of the sun. So I tell people, don't leave leaf piles around. Gather up your leaves, bag them, get rid of them, because otherwise those are going to be a tick magnet for sure.
Right.
Even though, I'm a card-carrying member of the Audubon Society, get rid of your bird bath, get rid of your bird feeder. They attract birds, which drop ticks. They attract mice and squirrels, which also attract ticks. If you can really get rid of mice havens in your yard, wood piles, old brush, old logs, anywhere that mice are going to hide, that's going to dramatically reduce your tick population as well. Try not to attract a lot of wildlife into your yard. I always remember as a new dad when my kids were watching Snow White, and she has all those lovely little woodland creatures around her with the long skirt. I'm like, listen, this is not this is Disney fantasy. This is not real, because you'd be covered with ticks with Snow White, right? You don't want to lay down with all those little squirrels and everything.
Well, it's important to know that there is safe ways to do it, and you can change the way that your yard is, and maybe decrease your interaction with ticks or having them.
Yeah, people need to get outside. They need to walk. They need vitamin D from the sun. They need to encounter other people. But there's definitely, between using your repellent on the skin, repellent on your clothing, tick roller, showering, drying your clothes. This is powerful stuff. And a lot of it is super cheap and easy to do. You just got to make it a habit. So,
I wanted to just touch on one more thing. Children with tick bites. What should parents be looking for? Because we had discussed in the past, and hopefully everybody's watched this already, watched our conversations before, that tick bites have a myriad of symptoms. And wondering, when children are the forefront of, they're the ones laying in the grass, they're the ones rolling around, what symptoms might you see in a child? And they might not present right away, right? They may present 3 months later or 6 months later, possibly even years later. So what should parents be looking for when dealing with children and tick bites?
Well, we definitely know, according to the CDC, that teenage boys are the number one population that is getting Lyme disease. Yeah. And definitely things like Babesia can have a 6, 8, 9 week incubation period or longer. So the classic story in the summer is kids develop a flu and they're feeling flu-like, and their COVID swab is negative, and their nose swab for regular flu is negative. So summer flus are not always COVID. Summer flus, we definitely start thinking about Lyme disease. Okay. In the long-term setting, we typically see for kids like a drop-off in their grades. Like little Johnny was always an A student, and now they've progressed into like a C- student. That is kind of one of the classic markers that there might be something tick-related going on. One of the classic kind of similarities we see when we're interacting with all of these different kids. So, flu-like symptoms in the summer, change in grade, change in habits. They're not as social as they used to be.
They could all of a sudden develop like an OCD of washing hands, or some sort of behavior, like an OCD behavior.
Right. And again, taking into account everything else that might be going on with a kid, but definitely in an endemic area for Lyme and tick bites, you want to think about that.